So using the large Harmony database, we looked at the outcome of over 1,400 patients affected by acute promyelocytic leukemia at a median follow-up of 5.5 years. This is one of the largest patient cohort analyzed, and patients' median age was 50 years, and there were also 30% of patients with a secondary APL and 20% of patients with a high SANS risk score APL. And 40% of those were treated with a chemo-free regimen Atra-Ato versus about 52% of the patients treated with the AIDA type chemotherapy regimens. 37% of the patients were treated in the context of a clinical trial. The findings included a confirmation of a relatively high risk of early death, accounting for 7% of the patients, associated with elderly age, higher SANS risk score, and the non-clinical trial context. In addition, we were able to confirm that patients treated with the chemo-free regimen had a significantly superior overall survival and event-free survival, and a reduced cumulative incidence of relapse. And looking at the multivariable analysis, this was independent of age, high SANS risk score, and also the survival was significantly inferior in patients treated outside the clinical trial context. This is a new information which was really made possible using the Harmony database. In addition, for instance, patients with a secondary APL did not have a survival probability different from that of de novo APL, confirming that the chemo-free regimen can also be used in secondary APL with significantly better outcomes. The potential impact of these results on the field is a confirmation of the efficacy of the Atra-Ato chemo-free regimen in patients with APL. Also in higher risk APL patients, there is still a high rate of early deaths, which should be looked at and taken care of with the objective of further reducing this complication, given the over 90% probability of survival long-term of patients with APL in 2023.